All right, hello. Welcome to Managing Pandemic Fatigue as a part of the Winter Wellness Guide that Jefferson is putting together. My name is Amanda Jenkins, and I'm a PsyD candidate at LaSalle. And I also have Jennie Bello with me, who is a PsyD candidate at Immaculata. We're working with Dr. O'Hare at the Jefferson Center City Clinic for Behavioral Medicine.
So as Amanda mentioned, we will be giving a review on pandemic fatigue, examining how it can be particularly impactful for healthcare workers, and giving some tips on how to most effectively manage it.
So, pandemic fatigue is kind of a new phenomenon, and it's described as this feeling of exhaustion stemming from, living with the impacts of coronavirus since really, last January, last February. It's perfectly normal to feel burnt out and fatigued right now. In fact, we might be a little more concerned if you weren't feeling any burnout after several months of living with all this uncertainty. But it's also important to note that not everybody experiences pandemic fatigue in the same way, both in terms of the severity and the actual symptoms that they're noticing. So how might you know if you're experiencing pandemic fatigue? If over the past several months you've noticed an increase in your fear, anxiety, feelings of loneliness, hopelessness, or sadness, this might be an indication that you're experiencing some pandemic fatigue. You may also notice that you're eating or sleeping more or less than usual, having trouble focusing or concentrating, feeling edgy, nervous, or more irritable with other people, maybe lacking motivation or noticing a tendency to want to withdraw from other people, or just having anxious, racing thoughts. All of these symptoms are kind of captured under this idea of pandemic fatigue and just the impact of living under, conditions of extreme uncertainty for months now.
Yeah, so this feeling of uncertainty, these fears about our health, are something that is experienced in the whole population. But for healthcare workers specifically, there are some factors that can be much more impactful when it comes to managing just emotionally during this time. So, this initial phase of COVID-19, that high energy beginning of the crisis situation, has started to pass, but yet we are still seeing these increases in numbers. And that uncertainty of, when is this going to end? When are we going to be able to manage this pandemic? Can lead some people to start to deprioritize self-care or coping strategies that maybe used to work in the past. Also, healthcare workers, because of the profession, are more likely to feel isolated than others. And this could include missing out on opportunities to travel or seeing loved ones because of that risk. And also having to communicate to those that you care about that you won't be able to see them despite wanting that connection can also take an emotional toll. Also, those increased demands of having so many patients to care for in this unprecedented way can leave a lot of healthcare workers who really valued spending time with patients, giving this care of not just medical care, but also helping patients emotionally as well. You may be stretched so thin right now that you're not able to deliver that quality of care that typically makes your job meaningful. So, yeah. So one real particular aspect when it comes to healthcare workers in general and this general population are, a lot of people are saying, I'm sick of COVID right now. These measures of masks and distancing are just too much for too long. And yet healthcare workers, as people are maybe deprioritizing wearing masks and social distancing, have to deal with the effects of that, of having increased cases and having an even more stressful work environment. And so, how do we communicate our needs for increased caution from those around us in a way that doesn't come up in our relationships in a way that can be damaging? And so some things to keep in mind go into this acronym of FAST. And so FAST includes being fair, unapologetic, sticking to your values, and being truthful. So by being fair, we're being fair to our own needs and the needs of the other person. We're being willing to listen and compromise, but only when appropriate. So we're not expecting others to always accommodate our preferences. And we're also not accepting not having ours considered or honored. And so that could include, if this person is saying like, I just don't see the point of wearing a mask if I'm outside and I'm just not going to do it. We can't just force a mask over their faces and expect that relationship to continue on as it was. So we might just have to accept at times that other people have different priorities, different interpretations of this pandemic. And if others aren't taking it seriously, we might need to make that decision to separate ourselves as appropriately. Another one is not being apologetic. So resisting that temptation to apologize by asking for what we need. Oftentimes when we're asking something of somebody, there's this guilt that can come with it, and it could lead us to apologize over something that we don't even need to apologize over, for this goal of keeping the peace. And so, rather than feeling like we need to apologize, to the person for asking them to take increased measures, we want to remember the values that we're sticking to here, whether the values are caring for your own health and the health of your patients. We don't want to sideline them just to maintain that relationship. So being clear on what we feel is the most valued way of thinking and acting. And then for that last one here, we have being truthful. So we don't want to make excuses for why we're asking what we are of those. We're not exaggerating the problem. We're just kind of sticking to the facts here. And so that leads into the next skill, which is Dear Man. And so just to overview it really briefly, so Dear Man is a really great way of being able to have a communication at moments when it feels really tough to ask what you're asking for. And so in this, we are describing the situation, we're letting the person know the facts, we're expressing how we're feeling. So after stating the problem, this is how the problem is affecting me. We're asserting what we need, and we're saying something to reinforce the relationship. So either showing our concern or even just saying thanks in advance, something to show our appreciation for what we're asking for. So Amanda and I will be doing just a brief role play on how this might work for a family member who's inviting you over for the holidays and will not take no for an answer.
So Jennie, I know you said that you weren't thinking you could make it to Thanksgiving, but it's Thanksgiving, we're a family, we have to celebrate. So do you want canned cranberry sauce or the fresh kind? I'm trying to figure out how much to buy of each.
Well, as you know, I am working at the hospital right now, and this pandemic's still raging. And I hear that you really want me to come over for the holidays, but I'm feeling pretty worried personally at putting you guys at risk, and as well as bringing any potential contamination back at my job. So because of that,
Fine, it's just a few of us.
Yeah, well, I'm still having those concerns about putting the people that I care about at risk. Even if it's just a few, that's still not something that I'm willing to tolerate. And so I'm not going to be able to see you over the holidays. And I'm doing this not because I don't want to see you. I would love to see you guys. I miss you, but I really care about your well-being and safety. And I just can't, myself, put that risk on you.
But you didn't come to Dylan's birthday party, and you also missed, there's one other dinner that we did that you didn't come for, so we haven't seen you in months. Are you sure that doesn't change things?
I know, but I'm talking about what's happening here now in this COVID time, and I feel like that makes it a lot more serious. So maybe we could figure out a way that I could still see you guys, because I do miss you. And the family. So maybe we could meet outside briefly, maybe if everyone has a mask on. Do you think that's something that you guys would be willing to do?
I guess if it's not too cold, because I know you still live pretty close, maybe we could do a drive-by thing just to say hi, or if it's really not going to work for you, then like, I don't know, you could zoom in for the apple pie at least at the end.
Yeah, I'd love that. Yeah, I appreciate you understanding.
Yeah, so that's just how Dear Man might work when you have a family member who is a bit more persistent than you would like. So some other general ways to kind of maintain your health mentally and emotionally and physically during the pandemic is to, make sure we're taking care of our physical bodies. So to reduce this kind of toll of living with uncertainty every day, we want to make sure we're still putting our physical health first. So, going back to basics, things like trying to prioritize sleep, getting at least 7 hours a night, trying to maintain a balanced diet, and moving the body every day, even if it's just taking the dog for a longer walk, doing some stretching or some yoga. It doesn't have to be a full-blown workout. All of these are ways to try to improve overall physical health, which might reduce our emotional vulnerability. Finding motivation to put these things first in the midst of everything that's going on might still feel hard. So just reminding yourself that these little habits may improve your overall mood could help you find the motivation to prioritize that extra hour of sleep or making that healthy dinner. Another way to try to cope as we are, in this ongoing situation is to limit our news intake. I know as medical professionals, we do need to stay informed on the latest research and the latest recommendations. So it is just about finding a personal balance between staying up to date with the latest information and not going into this territory of, news overload, doom scrolling on your phone to the point where it might be causing you additional anxiety. So two, techniques to try to manage news intake is to just take a break from the news for a day or two and see if this has any impact on your mood in a positive way. You could also set aside a designated time to scroll through the news and social media. Maybe it's, the first thing when you wake up and you're drinking your coffee, or before you go to bed, you spend 20 minutes catching up on the news. We're just trying to keep that to a discrete time period and then stopping once you're done.
Yeah. So we spoke a little bit about taking care of our bodies, but we also want to keep in mind what activities can we do to lower our stress, bring feelings of calm, and get some positivity in these uncertain times. So we want to focus on activities that are calming to us, bringing us joy, and this might involve getting a little bit creative. Maybe some of the things that you typically enjoyed are not available to you now, like maybe an indoor exercise class. So exploring other options that could help to get those feelings in. So even if it's just for a brief period, 15 minutes a day, trying to find time to really regularly practice these activities. And so that could include yoga, that can include guided mindfulness exercises, taking a walk in nature, reading, or lighthearted TV, like trash TV, reality TV shows, something where you just find your mind taking a break from the worry. And in addition to taking care of ourselves, our bodies, we also really need that social connection at a time like this. And so continuing to find creative and safe ways to connect with those that we care about while limiting physical contact. And this also is going to require some creative thinking. So this could be Zoom happy hours instead of, let's say, meeting each weekend for drinks, having that virtually, writing letters, sending emails, attending online religious services. And so if where you go to practice doesn't have them, it would be helpful to maybe look online and see what might be available to stream. Also just maybe sharing memes online with those that you care about, sending emails back and forth, doing check-ins just to make sure that your loved ones are doing okay. And so during the holidays, this might mean connecting differently than we usually do and creating new traditions. So one that we had kind of settled on during our brief exercise was doing like a Zoom dessert. So maybe a Zoom entire Thanksgiving might not really work out for the many hours that goes into Thanksgiving, but maybe for just like that hour of having dessert and coffee and connecting with those that aren't right there with us can be a new tradition.
Yeah, and a lot of what we've been talking about isn't new information. Like back in March and April, when the quarantine first started getting serious, people were doing Zoom happy hours every week, and you might have been prioritizing a lot of this stuff earlier on in the pandemic. But now that this has been going on for months and it's kind of the norm, some of these habits may have fallen off. So just trying to remind you of ways to still get these emotional needs met while living under these new conditions. And our last hope with this pandemic fatigue is to work on acceptance. So a lot of everything to do with the pandemic can stir up a lot of mixed emotions. We might feel angry and sad and guilty and scared and even happy. And these emotions might feel overwhelming and confusing at times. And one way to try to combat this is just to acknowledge and label your emotions when you're noticing them happening. Trying to ignore your emotions or judging yourself for the intensity of your emotional reactions or the emotions that you are feeling is only going to make things become more intense. And a nice little analogy, we have, it's raining, yep, and we have it's raining, I don't like the rain, I wish it wasn't raining, my day would be better if it wasn't raining, blah, 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 blah. So both of these people are wet, and one of them is also wet and probably a lot more angry and frustrated and annoyed because of this lack of acceptance, and just experiencing more suffering than they might need to if they were trying to take more of an acceptance stance. All right, and that's all that we have for you. Thank you so much for listening, and we hope that you can take some of these techniques to help manage whatever pandemic fatigue you're feeling right now.
All right, have a good holiday, everyone.